Good day, everyone. I am Maria Jennifer Joy Onyate from Iloilo Provincial Health Office, the person in charge for contact tracing. And I am here to discuss with you the personnel safety and precaution for contact tracers. This is in Module 5, 5.3, Basic Course in Philippine Fighting COVID-19, Contact Tracing in Communities. This basic course is in collaboration with WHO, World Health Organization Philippines, Department of Health Epidemiology Bureau, and University of Philippines Manila College of Nursing. The objective of this session is number 1, to identify ways to protect our contact tracing teams as they perform contact tracing activities in communities. And number 2, to know the terminologies and vocabularies used in contact tracing for better understanding. And now we will start with the definition of terms. Number 1, what is a close contact? A close contact is a person who has been exposed to a suspect, probable, and confirmed case of COVID-19. Number 2, what is PPE? PPE is personal protective equipment. This is a protective clothing to protect one's body from injury and infection. Number 3, social distancing. What is social distancing? It is a spatial distance with 1 meter or not less than 1 meter apart. Based on current evidence, COVID-19 is transmitted through direct contact and through droplets, and not through airborne transmission. Contact tracers can be potentially exposed to the infection during contact tracing activities. Because of an increased demand of personal protective equipment, there is currently an international shortage of PPEs. Given this, there is a need to ensure rational use of our PPEs, which includes our mask, face shields, and of course, our hazmat suits. Based on the WHO interim guidance of the use of PPEs, the use of PPE should be based on the individual's risk of exposure. Example, the type of activity you are in. Like in our activity, it is contact tracing. And the transmission dynamics, like it is direct contact, droplets, or aerosol. A healthcare worker who is directly caring for a COVID-19 patient would require higher levels of PPEs compared to someone who is not directly in contact with our positive patient. For our contact tracers who are doing contact tracing, we should observe a minimum PPE requirement, which includes our face mask and of course our face shield, which is also be approved by DOH. For those contact tracers who interview patients with COVID-19 or those who may have COVID-19 or their close contacts, if you do it remotely, means via phone or via Zoom meetings or video conferences, no PPE is required. But if you interview in-person interviews of patients with COVID-19 or their close contacts, this means you conduct face-to-face interviews with close contacts or positive patients. You should need or you should require minimum PPE requirements. What is our minimum requirement? Is the face shield and our face masks. And also, we should maintain spatial distancing with at least 1 meter or more than 1 meter apart. And of course, during your interview on face-to-face basis, we should conduct our interviews with our patients or our positive clients in an outdoor setting. During the interview as well, the patient should wear his or her face mask and his or her face shield as well. In addition to the use of our PPEs, we should always perform proper hand washing of our hands with an alcohol-based hand rubs or with soap and water. Please watch this video for the proper ways of hand washing.
Tamang paraan ng paghuhugas ng kamay. Ang wasto at regular na paghuhugas ng kamay ay mabisang paraan upang makaiwas sa mga sakit. Ito ay makatutulong sa pagpigil ng pagkalat ng virus na nagdudulot ng sakit. Una, basain ng tubig ang mga kamay at sabunin. Ikalawa, sabunin ang mga palad. Ikatlo, sabunin ang likod ng mga kamay. Sumunod, kuskusin ang mga pagitan ng daliri. Ikalima, kuskusin ang mga kuko. Ika-anim, kuskusin ang pagitan ng mga hinlalaki. Pagkatapos, kuskusin ng paikot ang mga dulo ng mga daliri sa magkabilang palad. At panghuli, banlawang mabuti sa malinis na tubig at patuyuin ang mga kamay gamit ang single-use towel o air dryer. Todo laban kontra coronavirus disease 2019.
Aside from hand washing as well, we should avoid touching our eyes, our nose, and our mouth. And of course, we should practice proper respiratory hygiene. If we are going to cough and sneeze, we should use our elbows in sneezing, bent elbows, and of course, a use of a single-use tissue and appropriately throw it in the trash bin. And lastly, we should maintain minimum standard for infection and prevention control measures, which includes our face masks and face shields. For additional updates and learnings, please watch this video.
Philippines fighting COVID-19, contact tracing. COVID-19 is an infectious disease caused by a new strain of coronavirus called SARS-CoV-2. It is spread primarily by direct contact between people through droplets produced by coughing, sneezing, or talking. These droplets containing the virus can also land on objects and surfaces around the person, such as tables, doorknobs, handrails, and cell phones. People can become infected by touching these objects or surfaces, then touching their eyes, nose, or mouth. This instructional video will discuss on the following. What is contact tracing? What are the goals of contact tracing? Who are the key players in contact tracing? What are the steps in contact tracing? One of the most important public health interventions to prevent the spread of COVID-19 is contact tracing. Contact tracing is the process of identifying, assessing, monitoring, and managing people who have been exposed to a disease to prevent onward transmission. It is an essential public health tool to break the chains of transmission of COVID-19. It requires rapidly identifying persons who may have been exposed to COVID-19, advising for quarantine, and following them up daily for 14 days. In contact tracing, speed is the key. As soon as a case is identified, contact tracing can start. The goals of contact tracing are to interrupt ongoing transmission and reduce spread of an infection, identify the sources of infection and track the chains of transmission, alert close contacts to the possibility of infection and ensure timely management and monitoring. The key players in contact tracing in the local government units are the members of the Local Contact Tracing Team, or LCTT. The Local Contact Tracing Team is led by City or Municipal Health Officer with a City or Municipal PNP Chief as co-lead. The members of the team are the following: City or Municipal Philippine National Police, physicians, nurses, midwives, and/or sanitary inspectors from the City or Municipal Health Office, local population officers, workers and volunteers from the City or Municipal Population Office, Bureau of Fire Protection, City or Municipal Disaster Risk Reduction and Management Office, and Barangay Health Emergency Response Team. Other staff, individuals, or sectors who shall be designated or deputized by the team leaders. Contact tracing involves 3 steps. Number 1, identify and list close contacts. Number 2, inform and profile close contacts and manage amplifying events. Number 3, manage and monitor close contacts. Step 1, identify and list close contacts. Upon identification of cases as suspect, probable, or confirmed in the disease reporting units, such as hospitals or community centers, close contacts are rapidly identified. Close contacts can be anyone who has been exposed to an infected person, family members, work colleagues, friends, healthcare providers, or the community. A close contact is defined as anyone with the following exposures to a COVID-19 case: from 2 days before onset of symptoms or date of specimen collection until the time the case has been assessed and tagged as clinically recovered. Being within 1 meter of a COVID-19 case for more than 15 minutes. Direct physical contact with a COVID-19 case. Providing direct care for patients with COVID-19 disease without using proper personal protective equipment or PPE. Staying in the same close environment as a COVID-19 case, including sharing a workplace, classroom, or household, or being at the same gathering for any amount of time. Traveling in close proximity with, that is, within 1 meter separation from, a COVID-19 case in any kind of conveyance. Exposures that occur in 3 C's: closed space with poor ventilation, crowded places with many people nearby, and closed contact settings such as close-range conversations. Other definitions as indicated by local risk assessments. A list of close contacts is generated using the Close Contacts Line List form, and this is forwarded to the local contact tracing team, or LCTT. Step 2. Inform and profile close contacts and manage amplifying events. All persons considered to have close contact with suspect, probable, and confirmed cases should be located and informed about the process and rationale for contact tracing and information on quarantine, where they will be quarantined and how they will be cared for, what symptoms to look out for during the monitoring period, what to do if they become unwell, and any other query or concern raised by the close contact. Close contact profile form is accomplished for each close contact. The areas, settings, and events where the suspect, probable, and confirmed cases attended or visited in the last 14 days are listed. Exposure to these events are recorded to help in identifying potential sources of infection. The LESU shall investigate high-risk places, settings, or events where outbreaks or clustering may have occurred or amplified. The LGU shall inform the public of such places, settings, and events, and advise to close, stop, or restrict access to such areas. Individuals who attended these places and events are advised to self-monitor and report if they develop signs and symptoms of COVID-19. Step 3. Manage and monitor close contacts. All close contacts shall be immediately assessed and immediately placed under facility-based quarantine or isolation depending on presence and severity of symptoms, and must finish the 14-day period even if the results are negative. Close contacts without symptoms should be immediately quarantined and monitored within 14 days for symptoms, ideally in community quarantine centers. Close contact with symptoms will be immediately isolated, assessed, and referred for testing as needed. Their condition should be monitored daily for 14 days using the contact tracing signs and symptoms log form and managed as needed. All close contacts information shall be submitted by the LCTT to the local ESUs to be consolidated and uploaded to DOH-EB COVID Kaya Information System. Data collected will be analyzed and utilized for decision making. Remember that contact tracing in COVID-19 starts as soon as a suspect case is identified. Laboratory confirmation should not delay the initiation of contact tracing. Speed is the key. Contact tracing is an important public health intervention to stop transmission of COVID-19. Collaboration of different agencies and cooperation of the community are needed for it to be successful. Let's stop COVID-19 transmission now. Detect, report, monitor, isolate, treat. It is our most urgent action today.
ikawan naton ang COVID-19, tandaan naton ang MMM. Maghugas, magmaskara, kag magdistansya. Thank you everyone, and I hope you learned something today. And for more questions, don't hesitate to approach me at Iloilo Provincial Health Office.